in doing a little research on this issue, ran across Dr. Geronimus. I think a number of people may know who she is. I didn't. But she described a process called weathering, where chronic stress, as a metaphor, is similar to what happens to buildings that are constantly, or structures that are constantly bombarded with rain, hail, snow, temperature changes, and that the effect is cumulative, that it builds up. And it also is a useful metaphor in that how can you blame the building for being where it is in the path of nature? We can recognize that stress, like health and income and other disparities, is a result of the institutional and personal racism that drives inequality and infects American society. Stress can also be a factor that pushes us over a tipping point that limits our use of adaptive strategies to reduce risk and harm. And while we can mitigate some of the damage through personal action, that is not the solution for prevention. So what does this mean in terms of communication and advocacy? Let's continue this point. Let's continue to strengthen the case that stress is a significant health hazard and arises from circumstances that are most prevalent among African Americans. For example, stories about the economic crisis focus on people who have lost their jobs, cannot continue to afford their mortgage, and eventually are foreclosed on or walk away from their homes. These stories often miss the opportunity to make the connection between the economic crisis, the stress it has created, and what it means to the health and well-being of affected families and communities, and how the safety net that could catch them is dangerously frayed. Researchers have the opportunity to initiate longitudinal studies like the one you just described, comparing changes in community health indicators across communities which are facing differing levels of economic dislocation from the crisis. It is also time to advocate for strengthening our mental health services, building stronger connections between primary care and mental health, and creating diagnostic procedures and tools that allow practitioners to recognize stress as early as possible. This will require practitioners to explore the quality of life of their patients and their families, to identify stressors and assess the health risks of untreated chronic stress. And perhaps a fundamental cultural competence practice should be to probe for the stress level in African American patients at every encounter. Last, we must take care of our children, our elders, and pregnant women who may be unable or reluctant to reveal the stress they feel, but who are the most at risk of serious health consequences from unattended chronic stress. Thank you.
Thank you, Mr. Freeman. Dory, can you talk a little bit about your personal experience and how you feel that it can relate to the coverage of disparities going forward?
Sure, I do come at this, I'm doing this right, both from a personal and professional point of view. But personally, to give you a little background, my grandfather, and I'm not going to really go back that far, but anyway, my grandfather came from the West Indies, from Barbados, moved to Brooklyn and started what was, at least according to my father, the best moving business in Brooklyn. Strapping individual, intellectually rigorous, and he died at the age of 60 when my father was 19. And that had an incredibly profound effect on my father. He wanted to do anything he could to make sure he didn't have the same, what we now call health outcome. He was already very athletically inclined, but he continued that, jogging, yoga. He went on to nutrition. Back in 1970 in Washington, D.C., I knew all about tofu. And as for going to the doctor, He loved going to the doctor. That was like his favorite opportunity because he would come back from the doctor and he would regale us with the tales of, I went to the doctor for X and he says that I have the heart or whatever of a 19-year-old. Not bad for somebody 40, 41, 42, 43, until he got to be 50. And then he came back from the doctor and the doctor told him he had inoperable prostate cancer. And he died 2 months to the day after his 56th birthday. Now, 13 years later, my husband, who was an architect, he was about 58, and within 4 months, he was diagnosed first with prostate cancer and then with a brain tumor and died shortly before he was 60. And so at that point, I became very interested in health disparities. But what I was reading, and as a journalist and as a child of a journalist, of course, I went to journalism to figure out what the heck is going on. But what I was reading didn't make any sense for my situation. It made sense. There were two stories, main themes. One was personal responsibility. People of color have bad habits and they don't go to the doctor. Well, you heard how my father liked to go to the doctor, and my husband was something of a hypochondriac. So getting him to the doctor was not so much a problem. And then the other theme was access, lack of access. Well, my father is married to somebody on the board of Kaiser, so really that didn't answer what was going on for us. I'm not saying, I think those are clearly issues, but they weren't the whole story, at least not in our case. And our case is unfortunately not family specific. Right now, a good friend of many of ours in this room is on life support at the age of 57. So it goes beyond our family, and I couldn't get the answer. Then I met Dr. Gail Christopher, who I think some of us in this room know, and she's an expert in this field and is now at the Kellogg Foundation. And she spoke at an event I was at. She spoke about middle class and upper middle class women who had a high, and this is including doctors, who had a higher than their white cohorts rate of premature babies and stillborn babies. So I was beginning to hear that there was something else going on, but I literally had to connect the dots as I read. I read another story that said that it looked at people's response to pain and found that people respond differently to those that they see in pain depending on whether or not they look like them. And then I saw another story in the New York Times that was about a medical trial. But in the course of that story, there was one individual who clearly wasn't eligible for this medical trial, and yet the doctor had identified with him, and so he was admitted into the trial. And so that was another picture that began to emerge. But we really weren't getting a whole sense of what's going on. And as journalists, that's our job. And the reason I share my story is that I'm hoping that from my personal narrative, people will begin to take a systemic look at what's going on with health disparities. And Robert mentioned earlier that we have our fault lines framework that looks at race, class, gender, generation, and geography. We think that those are all elements in the story that need to be addressed. And as we look at health disparities, clearly there's a racial element. That's the overlying fault line. But we then need to look at what does that look like across the other fault lines? What does it look like across class, across gender, across generation, and across geography? Because if we don't do that, we're going to fail to give our public the kind of information they need to really make both personal and public policy interventions that not only make sense, but make sense for everybody. Because while we need to increase access, clearly, and we need to change habits, clearly there is so much else that needs to happen. And we as journalists are the people that will help our audience understand what those things are that need to happen.
Thank you. I have a question in regards to this concept of framing. I'll ask a couple questions and then feel free for the audience to chime in and ask your own questions, because really we endeavor for this panel to be an opportunity for journalists and others to get a better sense of how to cover this. And so that's a little bit of where my question lies, which is at a time when there are fewer reporters and an increased appetite to feed this 24-hour news cycle, what advice do you have for journalists to practically frame a story that, as you alluded to, may appear on its face to not really have a connection to stress, or that there's a thread there that is not easily stitchable. So what advice would you have for journalists covering something that could be as about the foreclosure crisis, or something that's not clearly connected?
Fortunately, in this regards, every human activity can lead to stress, even the ones we enjoy the most. The foreclosure crisis is an easier one to connect the dots than most, in terms of, and it would be interesting if Kaiser could actually take a look at this, could take a look at this particular time period and see what's happening to patient experiences with the kinds of things in the index, and especially in the Inland Empire and Central Valley, where home foreclosures the most serious. But to you know, we know about the financial crisis, the loss of homes, the downscaling, and in some cases increased homelessness. But we also know about the marriages that are breaking up, the families that are being disrupted. And if we're going out and interviewing families who have stories to tell about their struggle with the housing market, questions about what's happening with your kids, what's happening with your friends, with your social circle, the kinds of things that we consider to be part of resilience. Are you being shunned by your peers now that you're difficult to be around because you're the one who's, you know, suffered the pain? And I'm afraid that even our good friends don't always want to be around us when we're hurting the most. So those kinds of paths down the road to take a look at stress, as well as with job loss, the loss of health insurance.
Mm-hmm. Okay. Does anyone else want to answer that question?
Well, I think that we spend a lot of time talking about how we cover stories that aren't material. Why are we sitting there talking about whether or not Obama has a birth certificate or not? But that's a perfect entryway into a story about stress, because I don't know if you saw those clips I sent you, but I've seen on the video a lot of indication that it's causing average African Americans a great deal of pain and stress to see that their president still has to prove he's legitimate. And so perhaps it's an opportunity, rather than doing another story about what Donald Trump says, but to do a story on what effect Donald Trump saying that is having on a large portion of our community.
The only thing, I think the only way that I would answer that question, because I'm not a journalist, but I think that there is something in common between journalism and medicine, which is that it's seeking answers to difficult questions. And in my experience, I have found that just listening to my patients and listening to the families that I care for, and recognizing when what I'm seeing doesn't line up with conventional wisdom, right? So I think that there's the opportunity to look at what's being presented and ask ourselves if that is consistent with our experience. And if it's not consistent with our experience, for example, with what Dory is talking about in terms of her experience with her father and her husband, saying, well, you know, this is what I've heard about in terms of why these things happen, and yet it's not consistent with my experience. So is there more going on here? And I think that's a really important question to be asking.
Thank you. Do you have any questions?
Yeah, I'm interested to know if there are any studies around stress in different immigrant communities, because there's a lot of, I would say, backlash against immigrants and undocumented immigrants in particular, or people who are here without a visa or whatnot. I don't know if there's any studies or any person you can point me to.
Yeah, there are lots of studies. There are lots and lots and lots of studies, both in the medical arena and also in the public health arena. And what's very interesting, both within immigrant communities and within just communities of color within the United States, there are studies reflecting the power of stress and people's social experience and how that impacts their health. So, for example, I unfortunately, off the top of my head, cannot remember the citation, the specific researcher, but there is a woman who I believe is at the National Institutes of Health who did amazing research looking at ethnic origins and skin color. And for folks of African descent, it's a very, very interesting research, which shows the blacker you are, the worse your health outcomes are. It was very interesting. It was let me rephrase that. I should say, black people who self-identify as black, but who appear white to a stranger, who appear Caucasian, have health outcomes that are much closer to whites than black people who self-identify as black, who appear black to other people, right? Very interesting data. They did they looked at another study, a gentleman at UCSF looked at renal function, so kidney disease, in indigenous Mexicans, right? So you look at the spectrum of the social hierarchy among the folks who live in Mexico, and those who are more of the indigenous ethnic background are more likely to hold jobs that are lower pay. And what was amazing was they did a DNA analysis of what percentage of indigenous Mexican DNA ancestry you had, and correlated that with income. The greater amount of DNA that you have of the indigenous Mexican population, the lower your income, the worse your health status. Like, it was just ridiculous. So there are lots of studies, and pretty much that was the interesting thing about when I went to public health school. Everything I learned in public health school was if you're an immigrant, you have worse health outcomes. If you're a person of color, you have worse health outcomes. If you're poor, you have worse health outcomes. And if you're uneducated, you have worse health outcomes. I'm just like, well, I'm a black immigrant from Jamaica. I knew that. Like, you didn't need to tell me that. The question is, why? How do we intervene? And how do we make it different? And that is, in my opinion, that's a big part of the problem, is that the research ends there, right? We stop asking the questions there because it meets our expectations. And when we start understanding that all of these populations are also exposed to higher doses of stress, which we know is toxic on the molecular level, which we know increases your risk for heart disease and COPD and all of those things. And so if we want to stop spending 17% of our gross domestic product on treating chronic disease. Say you don't even care about equality. Say you don't even care about people of color. If you would like this nation to remain competitive, because we would like to stop spending so much money on heart disease as a leading killer in the United States, we have to begin addressing these issues as risk factors for chronic disease.
Can I offer a friendly amendment?
Mm-hmm.
If you want to repeal health care reform in inequities in health, and we won't need health care reform. Maybe that's not true, but it's a good sound. It's still a good sound bite.
Robert, you have a question?
Yeah, so my question is for you, Dory, and you, Martin. And it's related to what Nadine put out, which is, are there, beyond the framework of analysis for writing a story, so like fault lines and other things, are there ways to push that framework in the medium and the tools that media uses to push stories out to get to the kind of Ronald Reagan question is the are you better off? And here's the thing that comes to mind. So the Bay Area newspaper group in Contra Costa County and has shown up in some of the Alameda County papers, less in the Trib, have at least over the last 3 years been writing about pension reform, right? And writing about pension reform as a civic reform that could help with the fiscal kind of situation in the state of California. And through writing that way, they've kind of stumbled on things or discovered things that they otherwise wouldn't have talked about in terms of innovations, right, or new ideas. And so the question is, given the conversation that we're having around health and how pervasive and how kind of impactful it is of all those other questions, is there a way or are there ways in which people are creating new venues, both within legacy media, but also just kind of new approaches that would allow for something similar, right? Where this notion of stress and chronic adversity and trauma, right, is asked in this vein of, are you better off?
I'll let you start.
Okay. I think that's an interesting point and a unique approach to how you may get into a story or a series of stories. Because I think a lot of times what ends up happening, certainly in today's world of journalism, is we are so reactionary. And we also approach stories that traditionally have been this concept of watchdog journalism, right? The pension reform is a perfect example of one of those. And is there malfeasance? Is something going on? Or is, by people not contributing, is it going to cause the greater budgetary situation to be even worse? But rarely are we connecting the dots in the way that you suggest. So I think it could absolutely happen, and I think there's definitely a way to approach a series of stories looking at something like that. I think it really comes down to having people in newsrooms that are getting this kind of information and then can sort of forge ahead on an approach such as that, where you ask the question and look at, well, what, if we're going to ask, are you better off, what are we going to look at to answer that question? And what resources are we going to draw in? So I think it comes from leadership. I think it comes from editors who are steeped in this kind of information, which is why such a program like this is good, a panel like this, and then have the will to take that information and then present some concepts that people may not realize or may not even be comfortable with, such as this one. And then I think framing it in the way that has been done, which even if you don't care about equality, right, you care about the country remaining competitive. And so if you want to raise all boats, if you want to care about your own, then you need to care about this. I think it absolutely could be done, but it takes journalists and news organizations willing to put their resources and ask those questions.
And I want to really emphasize what Martin's saying, is that it takes having people in the news organizations who understand a different way of looking at a story. Nadine was saying one of the things she would like to see journalists do is say, wait a minute, you're presenting me with data that doesn't make sense from my perspective, my understanding, except that in this, if you have, which we do, predominantly all white male newsrooms, you're presenting them data that they don't have any relationship to. So as far as they're concerned, well, I guess that's right. I don't really know. I mean, you know, we live in a segregated community. We don't really know people outside of ourselves. So, all right, I'll just go with it. Not only that, that seems to be an ongoing problem of those people. So really, how many times are we going to write about that? So I think you really have to work on changing both the composition and the mindset of the media if you want to change some of the outcomes.